Hi, my name is Abigail Nobles, and I am going to be speaking on myasthenia gravis. So, just for my overview, I'm going to do an introduction and speak about the prevalence rate, mortality rate, and its importance. Talk about the symptoms, a little bit about the anatomy, and I'm going to talk about how to diagnose and what is affected. I'm going to talk about treatment, common treatments, and lifestyle changes if there's a cure. All right, so myasthenia gravis is an autoimmune disorder that occurs when the immune system produces antibodies that block or destroy majority of muscles or their receptor sites for a neurotransmitter called acetylcholine. With fewer receptor sites available, your skeletal muscles receive fewer nerve signals. So the prevalence is around 2 to 30 cases per 100,000 cases, and it's increasing annually. The mortality rate is really kind of low. It's less than 5%. The incidence rate is 2 to 4 cases per million people per year. And for the demographics, it can occur at any age from early childhood to late adulthood, most commonly diagnosed in women under 40 and men over 60. Typically, women are more affected than men in younger age groups, but as people get older, this tends to become vice versa. So, um, it'll be more common in men and less common in women. And it does not affect a specific race more than the other. So, this picture um, kind of explains myasthenia gravis on a cellular level or nerve level. So the woman depicted in the picture has facial paralysis on one side of her face, which is usually what individuals with myasthenia gravis look like, sort of like Bell's palsy. Um, on the left side of the picture is the nerve and the receptor sites being blocked by antibodies so that the acetylcholine receptors cannot reach the acetylcholine and therefore communicate with the muscle cells. So, what is acetylcholine? Acetylcholine is essential for nerve cells to communicate with muscles, and it plays a great role in memory learning, attention, arousal, and involuntary muscle movement. ACH binds to these receptors to activate a process that causes the muscle to contract. Antibodies harm the neuromuscular junction's postsynaptic membrane, causing muscle weakness by depleting ACHRs and impeding synaptic transmission. What are the symptoms of myasthenia gravis? Symptoms include muscle weakness, droopy eyes, difficulty swallowing, diplopia, which is double vision, impaired speech, and shortness of breath. The symptoms, like I said earlier, do look very similar to Bell's palsy, but Bell's palsy only deals with the facial muscles and it comes and goes. Um, Myasthenia gravis, that is pretty much permanent. Um, how is this different than MS? MS involves the whole central nervous system. This is, like I said earlier, it is at the receptor sites that the problem is. So there are different ways to treat it. It's caused by genetics. It's not inherited, but 3 to 5% of people have family members with MG or other autoimmune diseases. It could be a thymus gland abnormality. It could be caused by infections or certain medications. Um, Potential infections that could cause MG or they're associated with MG are hepatitis B and C, herpes simplex, HIV, West Nile virus, Zika virus, and the dengue virus. Um, there is not a specific study that directly addresses the infection causing MG, but they have reported MG onset in connection with these specific infections. Medications you should avoid are antibiotics, such as telithromycin, botulinum toxin, D-penicillamine, and magnesium. And using with caution is another antibiotic, such as fluoroquinolone. I don't know how to say any of these. I'm sorry. um, Corticosteroids, statins, and contrast agents for imaging. Some of these are needed in some cases, such for like heart conditions, but they should be used with caution. Diagnosing MG. It involves several tests that may not be available globally. Um, the first would be a physical and neuro exam, and physicians may check for downward turned lips. Oh my gosh. A depressed face. They may test muscle strength and tone, balance, eye coordination, lung function, and reflexes. Another test that they might do as a blood test is used to detect specific antibodies, such as the anti-acetylcholine receptor, which is AChR, or anti-muscarinic antibodies, which are often elevated in MG patients. Another test is a EMG, which uses sensitive testing measures the variation in time intervals between two action potentials of the same motor unit, called a jitter. So its repetitive nerve stimulation is positive for 55 to 77% of MG cases. It involves stimulating nerves and measuring the decrement in compound muscle action potentials. And lastly is imaging. Oh, not lastly, actually. Uh, Next is imaging. A CT or MRI may be done to check for thyomomas, which are associated with MG. And then the last test is the androphonium test or the Tensilin test. It's where a short acting acetylcholine esterase inhibitor is administered and can temporarily improve the muscle strength, aiding in diagnosis. The picture on the right depicts a patient who has MG before the injection versus about 15 minutes after the injection, having normal strength and facial muscles. For treatment, there's medications that they can take, such as the cholinesterase agents, immunosuppressants, and corticosteroids. Plasmapheresis or IV immunoglobulin to remove harmful antibodies from the blood. A thyrectomy, which is surgical removal of the thymus gland, and of course, lifestyle changes to manage the fatigue and muscle weakness. Let's talk about some of those lifestyle changes. So, for the first thing you should do is to eat better or eat for your condition, which means eating more protein and carbohydrates and avoiding spicy foods such as lemon, dairy, alcohol, and eating smaller meals because larger meals cause fatigue. Avoiding meals that cause a lot of chewing and cut up food smaller. The next thing for your lifestyle change you should do is exercise gently, which means strengthening those muscles that you need to use and improve the overall mood. When MG is not controlled, exertion can cause muscle weakness, so exercise within your limits. And lastly, use safety precautions. Install grab bars in places where support is needed, such as bathtubs. And don't use extreme temperatures when taking a shower or icing or using heat, because extreme temperatures can cause weakness. And the best thing to be safe is rest. The prognosis for MG, long term, can lead normal or near normal life with proper treatment and management of medications. They have a normal life expectancy. The quality of life with early detection and treatment, most individuals with MG can have a good quality of life, even with moderate to mild symptoms. On the right, there is a picture of Christopher Robin, the inspiration behind Winnie the Pooh. He was an individual who had a hard life, not completely due to the fact that he had MG, but he didn't show any early signs of MG, but he lived for several years and died at the age of 75 due to the disease. Another famous person that we may not know of is James Carter, who is an individual with MG. He was diagnosed at the age of 12. He did have a thyroidectomy, which improved his symptoms significantly and led him to be a 2005 Olympian. And he is now in remission. In conclusion, myasthenia gravis is a long lifetime condition, and symptoms are similar to that of Bell's palsy and MS, which is caused by but is caused by antibodies blocking receptors, and the symptoms can occur at any age. And then these are my sources. Thank you.